Hello, so here we have chronic disease temperature biomarker number 7, neutrophils or absolute neutrophils. And what we have here is all our white blood cells, and neutrophils is just one type of these 5 different differentiated white blood cells. And it happens to be the one that usually is present in your blood at the highest level of all the individual white blood cells. So the neutrophil is what we're focusing on here. And neutrophils are a type of white blood cell and part of your immune system. And the neutrophils go up when your body is fighting generally a bacterial infection, sometimes allergies and inflammation, but they may be tied back to bacterial infection as it turns out. So chronic infections promote inflammation, and inflammation is really what's considered at the root of the major chronic diseases: heart disease, cancer, respiratory diseases, neurological and neurodegenerative disorders, all of those. So here's the early mortality chart. So we see cumulative survival. So as we go down, there's less survival, higher mortality. And at a neutrophil, absolute neutrophil count of 3.6, there's the baseline in this study. Our value is 2 to 3.5, standard of care 1.4 to 7. This is the mortality curve, and we can see at 4.6, 5.5, and 7.3, a significant increase in mortality as we diminish survival. So what we're seeing here is at around 88% to around 76%, a greater than 20% decrease in survival just by going from 3.6 to 7.3 continuously in a chronic phase over a number of years, 8 years as it turns out in this study. So this is what we're looking at from an early mortality perspective with absolute neutrophils. This is an important set of data here because if we're doing white blood cells, why are we doing neutrophils? Well, neutrophils are actually more exacting and more telling about mortality than are just white blood cell counts. We can see here that for each so-called standard deviation or standard increase in white blood cell counts, we see an 18% increase. But with neutrophils, we see a 33% increase in mortality. And that's higher than all the other white blood cells. The only thing that compares is the erythrocyte sedimentation rate, which is part of our chronic disease temperature algorithm as well. So there you have it, chronic disease temperature biomarker number 7, neutrophils or absolute neutrophils, a type of white blood cell that goes after bacterial infections. If you're slightly elevated in the chronic phase, you have a chronic bacterial infection, highly treatable, highly manageable by improving your immune system health, and that's, of course, what you want to achieve for a healthy longevity and long lifespan. Thank you very much. Tom Lewis here at Dr. Tom Lewis.